cooling, emotional strain and others. That cannot be considered as a direct reason of the disease, but as provocative factor. Then gradually the illness appears that is directly connected with the joint's damage. DENS and scanner apparatus operation leads to improvement of blood microcirculation around the damaged joints and in marrow that leads to partial or complete their recovery. The apparatus operation begins from sound joint in individual dose mode. The joint is treated from 3 sides. The under-knee pit is not treated. Then the operation transfers to the ill joint. During the patient moving, the maximal pain point is determined. The electrodes are put on this zone for 10–15 minutes, the mode is continuous, energetic level is maximal. The under-knee pit is not treated. In case of lower extremity diseases, the lumbar sacrum zone is treated. In case of upper extremities joints diseases, the neck collar zone is treated. Besides the 7th neck vertebra, jugular pit and common zones are treated. In case of ear, nose, throat diseases, the treatment is held from the maximal pain place. In case of ear diseases, that may be otitis, neurosensor impaired hearing. The ear and around ear zones are treated in continuous mode. In case of throat diseases, that may be tonsillitis, laryngitis. The front surface of neck with the mouth diaphragm is treated. It's possible to operate from the tongue. In this case, the apparatus is put on the tongue back in continuous mode on minimal energetic level for 2–3 minutes. In case of nose diseases, in everyday practice, it is usually rhinitis, when the patient is bothered by the nose blockage and nose secretions. The nose, wings and bridge are treated in continuous mode. The operation is held till the statement improvement, till the nose breathing recovery. Neurosensor impaired hearing is determined by the damage of sensitive nerve cells of internal ear, hearing nerve and central formation of hearing system. Neurosensor impaired hearing most often appears as a result of sharp infection diseases, side ototoxic medicines activity, production and daily life noise and vibration influence, organism intoxication with carbon dioxide, mercury, lead, manganese and others, inherited pathology and so on. In case of DENS therapy influence on the human organism, the inflammation is eliminated. If at least 25–30% of the hearing nerve is not damaged, the hearing recovers. The ear shell and area around it is treated. First, the operation is held in individual dose mode with revelation of pathological zones when the apparatus is transferred to continuous mode. The operation time is 2–3 minutes. The ear shell and ear lobe is treated in individual dose mode. In the zone of neck ring, the neck is treated by the apparatus in different directions, from spinous processes and to spinous processes in other direction. The mode is individual dose. The temple zones and closed eyes are treated. The apparatus operates on eyelids. The mode is continuous. Energetic level is minimal for 1–2 minutes.
При глазных заболеваниях, когда у пациента могут быть еще...
In case of eyes diseases, when patient can feel pain, have a feeling of sand in the eye, the vision sharpness can fall. The eyes area is treated. The apparatus is put on the closed eyelid on minimal energy for 2–3 minutes.
На 2–3 минуты.
Age farsightedness is the age insufficiency of the eye accommodation slowly reflecting by progressing worsening of uncorrected vision in work at close distance. There happen albuminoid concentration increase, yellowish shade enforcement, core and lens capsule thickening and its elasticity decrease under transparency preservation. The main symptoms of the age farsightedness are difficulties in watching of fine objects at close distance, fast already 10–15 minutes of vision work, fatigue of cilia muscle reflecting in letters and lines fusion, feeling of strain and pain in upper nails of eye, eyebrows, bridge of nose, more seldom in temples, sometimes even till nosy, a light photophobia and tearing. DENS and scanner apparatus operation leads to improvement of blood microcirculation around eye. As a rule, the apparatus correction of vision by 1–3 diopters. Closed eyelid. First, the apparatus operates in dose mode, then it transferred to continuous mode. Minimal comfortable level 2-3 minutes.
При заболеваниях полости рта
In case of mouth cavity diseases, toothache, inflammatory processes, pulpitis, stomatitis, glossitis and gingivitis, the treatment is held on shoal zone in continuous mode. The apparatus is transferred from temple area to the face central line by lower jaw and by upper jaw.
по нижней челюсти и по верхней челюсти.
Pulpitis. The tooth enamel is covered by fine soft film pellicula that consists of saliva proteins. On it the germs living in the mouth cavity stop. The germ concentrations form dense film. The basis of this film are badly soluble polysaccharides. They encourage microorganisms to stay on the tooth surface. Apart from the germs, numerous microorganisms take part in the tooth destruction. At first, only the tooth enamel is damaged. Chalk-like spot appears. If food or germ pigments stop on its surface, it can obtain yellow, brown or black coloring. The dentine layer protecting the tooth pulp from thermal chemical influences becomes thin. This determines toothache appearance from something called a sweat. Bacterial toxins coming through the thin dentine layer can cause tooth pulp damage. Its inflammation, pulpitis, develops. In case of DENS and scanner apparatus influence on the direct projection of the ill tooth, pain and inflammation is eliminated after what the main disease treatment at dentist is necessary. The apparatus operates on the direct projection of the maximal pain area. The mode is continuous, comfortable or maximal energetic level till the pain decrease or elimination. Further, the submaxillary area is treated in continuous mode, transferring or transposing the apparatus. The sound side is treated on dose mode. The neck ring zone is treated in several directions. In case of gums hemophilia, the shoal method is applied. The mode is continuous. The apparatus can be moved or transposed from one and another side.
Принципы работы по неотложным состояниям.
Imperative statements operation principles. Operation is held only in continuous mode. The operation termination criterion is the patient exit from dangerous statement or transfer of the patient to specialists. If the patient is in consciousness, the treatment is held on maximal energy.
Максимальной энергии.
In reanimation zones, the apparatus operates in continuous mode on maximal energetic level. The operation is held till the patient statement improvement. No steep area, upper lip and chin area. Heart front direct projection. Antispasmodic zones, upper lip. Palm from both sides. Temperature decrease areas. The carotids direct projections are treated. Continuous mode, comfortable energetic level, 1-20 seconds on each zone. Axilla is treated from both sides. Elbow flexion. Under knee pit. Thigh inner surface.